we're going to just change track completely, because Tracy mentioned to me that you would probably all like to hear a bit more about B12, because it's more down to earth, everyday stuff that we're all talking about and that we can do something about. And B12 is nothing new. It's one of your mineral vitamins that you need. It's been, known about for a very long time, and I can think back to when I was a medical student, which I won't say how many years ago. We were using B12 injections for tired old ladies, and so it goes back that far, and there's nothing new about it, and it's probably been used in all sorts of medical conditions and shown to be, as a result, pretty safe. And so that's the first thing to say. So where did we get into it with this illness? Well, the first that I can find, and I went back looking to see where it all started really, was this man called Regland, who is from Iceland. Now, you may not know, some of you, though some of you do know perhaps, that there's a condition called Icelandic disease, and this was one of the early epidemics. I think we're talking the 1940s, whereby in Iceland they had a really, really bad flu-like illness, ripped through the communities. It's a small population country, and many people were left with what we now call chronic fatigue syndrome, ME. Even to this day, many people are still suffering from it. And one of the issues in Iceland, which is a bit of an aside from B12, but I will mention, is that they have very short hours of daylight in the winter, and this illness occurred in the winter, and so people's ability to recover may well have been hampered by the short hours of daylight, lack of vitamin D, which is not what we're talking about, but lack of vitamin D may well have been implicated, so people were very slow to recover and many didn't recover. So that's why Iceland is interested in this illness. And this man Regland is actually, or I think he's still around, is a neurologist, and he's been looking at this illness because of the Iceland connection for many, many years. And his first paper was in 1997, when he was looking at the cerebrospinal fluid, which is the fluid surrounding the brain and spinal cord, in people with chronic fatigue syndrome, and he found that a compound called homocysteine was particularly high in the cerebrospinal fluid. Now, homocysteine and B12 balance each other out, so if one's high, the other's low. And he found, as a result of looking further, that the B12 in the spinal fluid was also low. And the lower it was, the more fatigued the person was, or the people were. So when B12 is high, homocysteine goes down. So, it's a kind of balancing act, really. Also, we've known for a long time that B12 tends to decline with age, so older people will often be found to have very low B12 levels, even in their bloodstream. Sometimes that may relate to diet. Often older people are not eating well, or they may not be absorbing things properly. And if your B12 is low, you get what we call neurodegeneration, so you may start to get numb toes, numb feet, or pains, cramps and what have you, and more fatigue. And also another study has found that high levels of homocysteine in the cerebral spinal fluid, and CFS, by the way, people always get muddled with CSF. So CFS, they think, oh, she's written it wrong. That's cerebrospinal fluid. It's nothing to do with CFS. But high homocysteine levels in the fluid is also associated with people who have dementia. So again, their B12 levels are probably very low. So where do we get B12 from? Well, it comes in a number of foods normally. Those foods I've listed there. It's not generally present in many plant foods, not to any degree that's of any use to us, and so vegetarians are much more at risk of getting low B12 and are often, particularly vegans, given B12 as a supplement. And how do we absorb it normally? Well, it requires stuff called intrinsic factor, which is a kind of protein in your stomach lining. And if you have normal intrinsic factor, you will absorb from your stomach the amounts of B12 that your body needs, and your blood level will dictate what your body needs. So in other words, if your blood level is normal, you won't absorb much. If it's low, you'll absorb more. So you need intrinsic factor to absorb it properly. And you may have heard of pernicious anemia, and pernicious anemia is due to very low B12 levels due to a person not having or not producing intrinsic factor, so they just don't absorb it properly. And those people have a condition called pernicious anemia, which is a particular type of anemia where your red blood cells are very large but very inefficient. And these people have to have their B12 by injection because their intrinsic factor is lacking. So that's a bit about that. So we then move on with Regland again, and 3 years ago he published another study looking at people with ME/CFS and found it was really important to combine the B12 with folic acid, which is another one of your B vitamins, because again B12 and folic acid need each other. And so he found good responses. Very good responses for some people, and it was less good for the people who were on some of those drugs that I've listed there. Sorry about the spelling on the last sentence, but those who happened to be on thyroid hormones because they had a thyroid problem coincidentally as well, actually did better from the B12 supplementation, and he thought that was perhaps tied in some ways with the genes that make you prone to thyroid disorder, which is then treated and you actually do better. So these kind of things were reported in that paper. Another paper by somebody else showed that B12 was really important for sleep as well, and when you are sleeping, you produce melatonin, which helps you sleep, and then as the night wears on, you're using your melatonin efficiently, and the levels are dying down, and you feel hopefully bright and alert when you wake up in the morning. And they found that the B12 actually had some real benefit in all sorts of people with different illnesses where there was a sleep problem. And of course ME has got a very real sleep problem. So what do we do in this illness? And this is what I would call the dosage protocol that I use. And we have got, good evidence now that it's a useful thing to be using. And hydroxycobalamin has been found to be the best form of B12 for injectable treatment in this illness. We used to use cyanocobalamin, which had sort of a bit of cyanide in it, and people weren't very happy about that, but hydroxycobalamin is the usual one now, and 1,000 micrograms weekly for 6 weeks is the sort of trial really. And a lot of people overseas, such as Charles Lapp in North Carolina, who's one of the world's leading CFS clinicians, uses it daily, and he gets some very good results. But anyway, my plan always is use it for 6 weeks. It takes about 3 to 4 weeks before there's going to be any benefit, if at all. And I say if at all because probably benefit shows in about 70% of people. So there will be 30% who don't seem to have any response at all and may not have the issues we've been talking about. If there's a good response, the person completes their 6-week course. I always tell them to complete it anyway, because some people might be slower responders. And then if they've responded well, they can either then wait a bit and see what happens, and some people will stay at a better level for about 3 months, and then it begins to drop away a bit. Some will begin to drop off within a week or two. And we sort of work on something like a monthly booster for people whose levels seem to drop off. the blood levels, when they're measured, when you go to the lab, will be very, very high. And I would say that, you know, you might well have been to the doctor and got a blood B12 done, and the doctor says, oh, you don't need B12, your level's high or normal, but it's not the level in the blood we're looking at, it's the level in the cerebrospinal fluid, which we can't easily measure, you know, without a lumbar puncture. So by pushing the blood level up, you're getting more into the cerebrospinal fluid, which then, of course, is all around the brain. So the blood levels tend to get very high when you're having injections, and some doctors feel uneasy about that because they haven't quite been taught about the mechanisms and the safety angles and all the rest of it. Although this has been around and been used in this way for probably 50 years or more, there haven't ever been any serious documented, serious life-threatening or dangerous risks. Nothing's been documented. That doesn't mean to say that for some people there might be a hazard, but for the majority it doesn't seem that there's anything to get too worried about, and probably to be keeping one's system nicely balanced, it would be worthwhile also taking a folic acid tablet 5 milligrams a day, so your folate levels don't get low, because if B12 goes up, folate tends to drop away, and you do need both. So we usually supplement with folic acid, which is also considered very safe. They're both what we call water-soluble vitamins, so they don't build up in your system like some vitamins. Vitamin A and vitamin D can build up in your system because they're oil-soluble, and they don't, your body doesn't get rid of them efficiently. But B12 and folate are safe from that point of view. They're talking a lot these days about supplementing bread with folate and all this kind of thing, because it does help prevent some of the birth defects that we now identify. The one group of people who have been found in another lot of research to possibly have a risk from B12 will be pregnant women. Not that it sort of poisons or does anything damaging to the woman, but they've found there's a slightly higher risk of autism in the babies or children growing up after women have had high doses of B12 during pregnancy. So that is one risk which needs to be considered if a woman is planning a pregnancy, coming off her B12 and just having normal intake. But we know she needs more folic acid in pregnancy to help prevent abnormalities of the spina bifida particularly. So, there's a lot more research going on looking at it now. What do we have here? These are the side effects that some people might experience. Very rare, however. I mean, I've had hundreds of people have B12 injections, and I think I've only ever had 2 who've described anything in the way of a rash, mild rash. A few people, not my patients, but have read about some slight incidents of nausea on B12. There's been some reported evidence in the literature of some people becoming more anxious. Sometimes it's an anxiety about actually having an injection. People sometimes faint with injections of any sort. Occasional itching and bruising around the site of the injection, much as you might get from any injection, really. But that's about all in the way of any serious worries. Oops, we finished that now. So that just gives you a brief overview of B12 in relation to this illness, and I will say that particularly in America they use it a lot. As I say, Charles Shepherd will be doing a daily injection in a lot of his patients fairly long term, and hasn't come up with any serious concerns, and this is over quite a long period of time now. So I think one can feel fairly confident about its safety. So I'm going to finish there. We've probably got a few minutes, haven't we, Tracy, for a few questions? 5-10 minutes of questions. So anything to do with either that or the conference or anything else? Yeah.
What about sublingual B12?
Oh, this lady's asked a very important question. Thank you. Sublingual B12, is that going to be as good? First of all, if you swallow the B12 in tablet form, it doesn't make much difference to your blood levels at all. and we are wanting the blood levels to go up. So injection gives you the big level, swallowing it hardly makes a difference, but sublingual, which is either on the tongue or under the tongue, you can get sprays or you can get tablets that dissolve in the mouth. They will, you know, if you say your blood level with injection is here and with the tablets is here, your B12 will sort of, the sublingual type or dissolve in the mouth type will come up fairly well. Takes quite a lot longer though, and it's often very hard for people to be able to say whether it's helping or not, because it's a very gradual effect, whereas the injection effect is much more dramatic in some people. But what I'll often say to people, you know, if you've had some response for the injection, you could probably then maintain your good level with the sublingual variety. And you have to buy it over the counter. It's most chemists or health food shops will have it. Yeah.
What is a good level? Because I've read that in some countries it's quite a lot higher than in New Zealand.
Well, the level, this lady asked what the level should be, and you know, the lab quotes what they call a normal range, but people on B12 injections, the lab will not measure anything above 2,000 as your, you know, if it's come up to 2,000, they won't go on measuring it. They just say your level is now over 2,000. Something's beeping. But I think the level that we aim for is 2,000. And if it's at 2,000 or over, you know, that's usually when response will click in.
Mine was on between 500, like the level to go up to 500.
Yeah, 500 is the sort of top normal level usually. So, you know, the lab will give us the measures from then on up to 2,000, and after that they say it's 2,000 plus. So,
thank you.
Yeah.
Just going back to your first presentation, there seems to be a huge immune component in every chronic fatigue. So I guess my question is, can that chronic fatigue influence or occur alongside other autoimmune conditions? Right.
Okay, this lady, if you didn't hear, asked about the immune components of chronic fatigue syndrome and whether it exists along other autoimmune conditions. First thing to say is it's considered now to be a disorder or disease of the immune system with strong neurological component, and the International Centre for Diseases, which sort of, and the World Health Organization, which classifies diseases, classifies it as a neurological disease, but the chemistry indicates that that is all due to immunological issues. So we know for sure the immune system is affected, usually highly activated in a very abnormal way, and some of the things we've already mentioned today. So there are definitely immunological changes, and a lot of those changes are very comparable to the autoimmune conditions that we know about, such as Sjögren's syndrome. They even think a lot of the rheumatological conditions are autoimmune, and the thinking is that this is probably likely to end up being classified as an autoimmune disease. But certainly if you have one autoimmune condition, you can have a number of others. And for example, most thyroid conditions are autoimmune, diabetes is autoimmune, multiple sclerosis and so on. So, you know, if you've got an autoimmune tendency, you might develop others, but you may not, you know. I mean, we all inherit genes for thousands of diseases, and we only develop, fortunately, maybe one or two of them, but you know, we all carry lots and lots of genetic load of all sorts of diseases that we're a little bit more prone to. Okay, any other questions? You probably already, oh, we've got one there.
I read that CBT and graded exercise theory are spreading to Denmark. So
yes.
This is the recommendations of the PACE study seem to have weight in Denmark, and there's talk of Finland being receptive, open-minded to these sorts of ideas. Is this a cultural problem that they have in these countries? Is it the Benelux countries, Netherlands, the United Kingdom, Denmark?
It's hard to say really. I mean, I think, you know, recommendations that came out of this so-called PACE trial in Britain was, graded exercise and CBT was the treatment for this illness. And I think it's become very obvious now that the graded exercise aspect of it was certainly very damaging for people with the illness, whereas the cognitive behavioural therapy, if it's done sensibly and properly, does have benefit in every illness. It's a way of understanding what your illness is about and how best to cope with it. It's not really curing the illness. And as this gentleman says, a lot of the European countries take on board probably what Britain has published in this so-called PACE trial. And I think actually most of the doctors who are working in the field of chronic fatigue syndrome and the researchers are not into the graded exercise and the CBT, but a lot of the GPs who don't understand the illness may well take it on board because it's been published in Britain by, big sort of people and in the past, but the British people are now moving right away from it, and all the indications are that that's just going to go out the window, and hopefully those other European countries will follow. But it's it's been the issue with this illness for a long time, that it's the lack of understanding, and sometimes quite prominent people get up and try and beat their own drum and say, well, this is how you should be doing it. But I think the British people now are moving right away from it, the ME Association, British Medical Association, and they're getting much more following the American lead too, which is the Americans producing guidelines on the Centre for Diseases Control and so on. And I've just recently been working with Dr. Karen Chung. She's I don't know what you'd call a position, but she sort of advises the Auckland District Health Board on guidelines for different diseases, and she writes them up helps write them up for different diseases so that doctors and nurses working in those organisations can call upon these guidelines if they have a patient they don't quite understand. So we've totally rewritten the guidelines for the Auckland District Health Board for this illness, associating the latest research and the best possible options for treatment. So hopefully that's going to make a difference, because once one health board does it, the other health boards around the country can buy those guidelines to use in their own districts. So things are changing, that's for sure. So we better finish, hadn't we?
Any more questions? What stood out for me is the the salt with regards to sleep. I've written a quick note. You're slightly raised this oroxin
Right.
sleep, but then I was wondering, so therefore if it's sensitive to salt.
Well, yeah, I mean, this is a big issue. What you need is lots of salt through the day to keep you alert and going and busy and active. So maybe there's some salty things over there, but a pinch of salt every 2 hours through the day is what you should be aiming for, but decreasing it towards bedtime, but upping your glucose component. So probably a nice couple of slices of chocolate at bedtime are quite a good thing to do.
Because my first thought when I heard that was, what about our orthostatic intolerance? Like I'm being
Yes,
our talk last year, which was about salt and orthostatic intolerance.
Yes, you need the salt through the day, definitely.
Yeah.
Your body actually learns to balance these things quite well too. If you sort of treat it right, it begins to sort of stabilise.
So, that's good. That's great. Okay. All right. Thank you so much. That was really informative. I don't know about you, but I found that very informative. And the B12 was awesome as well. And to hear, about that, especially how to get it naturally and through your diet.
Yes, if you up the diet, it makes a big difference.
Yeah, and also that can also prove a problem for a lot of people who are either vegetarian or who have IBS or digestive issues. So, so it's a catch-22 for many people. Rose Vallings, for those who don't know, she's our expert in New Zealand. She's our GP that we refer people to when they are struggling with their own GP to get a diagnosis. So this is the lady that you want to go and see if that's the case for you. So
However, I will say a lot of the GPs in Hamilton are now really good.
they're starting to
They're
get
getting
the
right
hang of
into it, and I get lots of phone calls from them for information. I've got the book over there, as Tracy said. I've also got the other 2 books I've written. Oh God. One for young people, and then what they call pocket guide, which is a sort of précis of that one over there. So if anyone wants those, we've got those available too. And a lot of GPs are asking for them now, which is really good.
Words getting out there, which is fantastic. So, okay, thank you very much.
Thank you.